we sneeze, the moment we sneeze, we come to a self-diagnosis that we are COVID positive. It may be due to a simple cold allergy or a dust allergy, which we were thinking a few years ago, at least hardly 1.5 years ago, when we sneeze, we used to say, wish you 100 years of life. But now, if our neighbor sneezes, we just run away from the place. The main impact is not the disease, but the fear of the disease. Even if you get COVID, you will automatically recover on your own, or there are a lot of medications which are available. When diagnosed earlier, you'll be getting a faster and easier recovery. But the fear of the disease is what actually kills us. So the main motive of this webinar is to have a clear idea about certain diseases, which usually women of 40 years of age are more prone to develop, and what we are supposed to do in our early adulthood to have a healthy aging. So in general, a human life can be divided in 4 cycles. Stage 1 will be your childhood, which is up to 12 years of age. Stage 2 will be our adolescent period, which is 13 to 19 years of age. And stage 3 will be early adulthood, which is 20s to 40s. And stage 4 will be late adulthood, which is 40 plus. So today, we'll mainly discuss about women's issues, which we usually face in the early as well as in the late adulthood. So first, regarding early adulthood, that is 20s to 40s. So in the initial 20s to 30s, most of the problems are related with marriage, pregnancy, or infertility. So for example, we'll just have a glance about those diseases. First common thing immediately after marriage is infertility. The moment we get married, the society expects us to become pregnant. So infertility is not only a health issue, but it is again a psychological issue. The second thing will be pregnancy. Illana illandra kora irukna adha vachu nariya kora. So that is what comes to pregnancy. So during pregnancy, a lot of diseases occur, but just remember, pregnancy is always physiological. Pregnancy is not a disease, but due to the various changes which occur during pregnancy, we are more prone to develop certain diseases, particularly during pregnancy. It may be diabetes, which is called gestational diabetes, or it can be pregnancy-induced hypertension, or it can be pregnancy-induced hypothyroidism, or pregnancy-induced anemia. All these have a cure. When diagnosed earlier, it will neither affect you nor your fetus. So all these lies in the hands of your doctor. And the third thing, during childbirth, postpartum hemorrhage, that is excessive bleeding during delivery, is a common problem which we encounter of late. It is mainly due to maternal stress as well as maternal malnutrition. The next problem of this age group will be post-childbirth, which is some urinary incontinence, that is inability to control urine, or it can be hemorrhoids or piles which develop particularly during excessive strain during normal delivery, or it can be a prolapsed uterus, that is your uterus coming out through your vagina due to excessive straining during normal delivery. So these are the issues which you should be able to know, but that lies in the hands of your treating doctor. Now coming to 30 to 40 years of age. So this is the age in which we face most of the problems, and we have a lot of solutions which follow during this age group can lead to a happy 40 plus. So the common problem now which we encounter is diabetes. So we'll mainly discuss about the non-communicable diseases or the chronic diseases, because I think we'll have a lot news data gives a lot of information about the present infectious communicable disease. So we'll mainly focus upon the non-communicable diseases today. So earlier, some several centuries or decades ago, diabetes was a very rare disease. But nowadays, at least one in a family definitely has diabetes. So usually diabetes is called the disease of the rich because it is mainly due to the dietary patterns which we follow. Any communicable, non-communicable disease can be prevented or can be kept under control mainly by 3 important things. That is your diet, regular physical activity, as well as your medications. So first, talking about diet in diabetes, the main thing, the first thing which your doctor advises in a diabetic patient is stop taking sugar. So the moment we advise this to a patient, their face totally changes. Initially, the patient never wants to take any sweet. By the moment we advise them, they have a craving for sweets. And not only that, for the moment we tell them, reduce the consumption of sugar in your tea, coffee, or milk, what do they say is, the next visit when they come, they tell us, doctor, we have totally cut all our sugar under control. We have totally reduced our diet. We have reduced the consumption of sugar in my diet. I have totally reduced the number of tea in my diet, everything. But when we check the sugar levels, there will not be much of change. So when we go on having a deep history with the patient, they immediately tell us that is just a comparison. What they tell us, I just take 6 cups of tea. Earlier, I used to take 10 cups of tea with 3 spoons of sugar. But now I have started to take 6 cups of tea with only 1.5 spoons of sugar. So I have drastically reduced my sugar consumption, but still my diabetic level is not under control. This is a very, very wrong concept, which most of the people follow. A poison is a poison, whether it is a drop or a bottle. So what makes the difference is the severity of the disease, that's all. But a poison is always a poison. The moment when you're advised to control sugar in your diet, it is not to control, it is to stop. Either you stop taking sugar in your diet, or you stop the tea or coffee, which induces to take sugar in your regular diet. So the first thing to be followed is avoid sweets and sugary food. The second thing will be cut off your carbohydrate. In our Indian diet, totally stopping carbohydrate is practically not at all possible, because carbohydrate is the immediate source of energy. It gives us the immediate glucose levels, which is necessary to maintain our day-to-day routine work. So cutting off carbohydrate is highly impracticable. So what you do is just reduce the consumption of carbohydrate. So the main thing which we encounter is, most of the patients, they tell us, we had been taking rice 3 times a day, but now I have cut down my carbohydrate. I just consume 4 dosas in the morning, 2 balls of rice for lunch, and 4 chapatis in the evening. It never serves the purpose of cutting off carbohydrate. Your rice is the same carbohydrate as in wheat. So what you consume matters. The quantity of food you consume matters, not the rice or wheat. So the ideal diet which we advise now is, we cannot say don't take carbohydrate. So what we say is, cut down the carbohydrate. For example, if you have the habit of taking 4 idlis in the morning, cut down that to 2 idlis. So the moment you cut down your carbohydrate in the diet, definitely you will feel hunger within 1.5 to 2 hours. So what do? You take a substitute for carbohydrate. For example, it can be some dal, or which is rich in protein. It can be some fruit salad. It can be some vegetable salad, which are rich in vitamins and minerals. Or it can be a simple buttermilk, which does not add too much to your calories. So this is how you plan your carbohydrate diet. The simple step is, cut down your carbohydrate diet to half. Compensate it with proteins, minerals, or vitamins once in every 1.5 to 2 hours. Your major meal, that is your breakfast, lunch, or your dinner, can include carbohydrate, but your snack meal should have protein, minerals, vitamins, and so on. So this is the first thing which we have to do for a diabetes. More than sugar, carbohydrate is more dangerous. The next thing which we discuss about a diabetic diet is whether a diabetic patient can consume fruits or not. The answer is yes, also no. What happens is, initially when you're diagnosed to be a diabetic, what happens is your body develops glucose intolerance. Fruits do not contain glucose, but they are rich in fructose. So when you take fructose, there will not be any major deviation in your blood sugar levels, or sugar levels do maintain. But chronically, slowly, your body develops intolerance towards fructose also. So when you consume fruits, when a chronic diabetic patient consumes fruits, gradually their sugar level begins to shoot up. So what about taking fruits is ultimately the question to be answered. What the answer is, you can take all the fruits. The fruits contain carbohydrates, but still they contain minerals and vitamins, which is essential for your day-to-day living. So what we advise is, take all the fruits, but in limited amounts. And the worst fruit, which is to be avoided in a diabetic patient, will be watermelon, which adds to a greatest surprise. Earlier it was said a diabetic should avoid banana, mango, as well as all the fruits, that is mainly jackfruit, and all the vegetables which are available under the ground. But of late and of recent studies, what they have diagnosed or what they have discovered is that it is not the sweetness in the fruit which adds to your diabetic level, but the glycemic index, which is the marker for a diabetic individual. So the fruit which has the highest glycemic index is watermelon, and that has to be avoided by a diabetic patient. Rest all the fruits can be taken in respective smaller amounts. That is not at all a matter. Similarly, vegetables, the vegetable with the highest glycemic index is carrot, and that has to be completely avoided by a diabetic individual. Rest all the vegetables can be consumed in moderate amounts. So this is regarding the fruits and vegetables to be taken by a diabetic individual. Then switching over to the physical activity, what we usually say is, that is what WHO advises is, 45 minutes of walking at least 5 days a week is more than sufficient to maintain your sugar levels under control. But if we advise this to our patients, the moment we say at least 5 days a week, they immediately start to follow 3 days a week. And the walking, the more pathetic stage of walking is, we find a lot of reasons to avoid walking. Lot of reasons. One thing, the common thing which we hear is, there is a huge distance between hall and kitchen. I had been running between hall and kitchen at least to 10 to 15 times a day. Particularly during this COVID lockdown, I'm totally laid in the kitchen and I prepare snacks and sweets taking from the kitchen to the hall. That is the common thing. So I don't need walking. I have more than what is sufficient. Second thing, what they advise is, now it is COVID, so I'm not supposed to go out due to a lockdown. But we go out to purchase clothes and everything, but we never go out taking our health under consideration. That is the second common thing which we encounter. Third thing, I don't have a good companion to have walking. Walking doesn't require any companion or any excuses. It is as simple as that. 45 minutes of brisk walking at least 5 days a week. The more you go, the more is your health getting benefited. So this is regarding walking and physical activity. One more question which we usually encounter is, I have severe knee joint pain. I have osteoarthritis. I am an elderly individual. How can I cope up with walking? You can go for simple meditation. Of late, it is proven that meditation has equal effects as that of your physical activity. So engage yourself in yoga or meditation. Keep your mind stress-free and relaxed. That provides an effect which is equivalent to 45 minutes of walking. And the third thing will be medications. The moment we prescribe a medicine for diabetic, even the patient will be willing to take the medicines, but your neighbor will often involve in your medication list. Don't take the medicines as prescribed by your doctor. It will have an effect on your kidneys. This is the first thing which most of the patients come back. In the OPD, the patients are very well convinced, okay, immediately today onwards, I'm going to start my medicines. The moment they go home, their friend advises them, don't take the medicine. Doctor doesn't know anything. Immediately they'll start the treatment. You just control with your diet. If you start taking medicines for diabetes, you have to take it lifelong, and that is definitely going to affect your kidney. And this is the worst advice any friend can give you. Because always life is a risk-benefit ratio. Similarly with the medications. When you try to take a medicine for diabetes, it is going to have less than 2% impact on your kidneys. For example, if you take an anti-diabetic medication for nearly some 2 to 5 years, only some 2 to 5% of your kidney is going to get involved, and that too, it will not have any effect on renal failure or kidney injury. But if you have an uncontrolled diabetic level for about 2 to 5 years, nearly 80 to 90% of your kidney would already go for damage. So life is just like that. It is just a risk-benefit ratio. Comparing the, I do not wanted to give you a wrong information by saying that all the drugs do not have any impact on the kidneys. They do have, but Comparing the risk and the benefit of taking an oral hypoglycemic agent is always higher than that of acquiring the disease, that is diabetic nephropathy, which is more dangerous. So that can end up in acute liver failure or chronic kidney injury, which will lead to multiple organ damage in near future. The raising concept now is, earlier, people with even 200 or more who were not advised any medications unless they became symptomatic. Of late and of recent studies, what they have discovered is, the moment a patient is diagnosed to have diabetes and the moment it is kept under control, you are preserving the functions of your pancreas. Yearly control of blood sugar levels can help to prevent microvascular complications. What are microvascular complications in diabetes? It can be diabetic retinopathy, which affects your eyes, diabetic nephropathy, which affects your kidneys, and diabetic neuropathy, which affects the nervous system in your body. Most of the patients do come with a complaint of loss of sensation over the feet, or feeling like walking over a cotton, or having some numbness or neuralgic pain over the foot. And these are all symptoms of uncontrolled diabetes. Once these symptoms begin to appear, already your organ would have gone for damage. We are not able to pick out these microvascular complications at an early stage. So that is why you're advised to maintain a strict diabetic control from the date of diagnosis of the disease. And by doing that, you can also preserve the function of the pancreas. As you all already know, insulin is secreted by the pancreatic beta cells. So you can maintain adequate functioning of your pancreatic beta cells. And the next concept is regarding insulin. Insulin is usually advised for type 1 diabetic patients. We need not go too much into type 1 and type 2 diabetes, but just for your knowledge, type 1 diabetics only require insulin. But in certain conditions, even type 2 diabetics are also advised insulin. For example, you go to a doctor and he prescribes you to take insulin. The moment the doctor writes insulin, the very next day you switch over the doctor. Never switch over from oral drugs to insulin, but you change your doctor. It is the concept which is followed now. So what are the guidelines which is given by the WHO to the doctors is, when your blood sugar levels are not under control, even with 3 oral anti-diabetic medications, then it is always safer to switch over to insulin. Why? Because as I have already told you, insulin is secreted by the pancreatic beta cells. As per studies, every year, 4% of your pancreatic beta cells are destroyed in a diabetic individual, even though your sugar levels are under control. For example, if you're diagnosed to have diagnosed to have type 2 diabetes at 30 years of age, by 31 years, 4% of your pancreatic beta cells would already have been destroyed. So the earlier you are developing the disease, you are having more chances or more probability to switch over to insulin at some point of your life. You consider this example, you allot a work to 5 persons and you tell them to complete the work in 5 days of time. The more pressure they face, the more mental stress or the sleep disturbance they face is really obvious. Instead, you split up the work to either 10 individuals to complete the work in 5 days, or 5 individuals, you give them a period of time and give them time to complete the work in 10 days. The work gets completed with minimal stress and with minimal tension. The same with your pancreas. The more pressure you put on your pancreatic beta cells, it tries to squeeze itself to produce insulin. But over a course of time, your pancreas works and finally gets tired. So what do doctors do in this stage is, they switch you over to insulin for at least some 2 to 3 years, so that they give rest to the pancreatic beta cells. So over due course, after rest, as individuals, after rest, when we start to work brisker, the same with your pancreas. When you give rest by providing insulin, the pancreas is under rest for about 2 to 3 years. So after 3 years, when you gradually switch over from insulin to oral diabetic agents, your pancreas works faster and it works better. So that is the reason why type 2 diabetics are also advised to take insulin during some point of time. So whenever your doctor advises you to take oral medications, or switches you from oral medications to insulin, feel free to discuss to your doctor, neither avoid changing your doctor. So these are the things which are to be followed in a diabetic individual. So the next disease will be hypertension. So as I have already told you, the same three concepts apply to hypertension also. First is your diet. As we advise to avoid sweet in diabetes, because diabetes is a sweet disease, hypertension is a salty disease. So it's better to avoid salt in a hypertensive individual. Salt in the sense, it doesn't mean that the salt which we add, or the raw salt which we add. It is the indirect salt which is present in foods like pickle, dry fish, puppets, and in general, it is advisable to avoid all the bakery items which contain a lot of indirect salt. So salt avoidance is the first dietary change to be followed in a hypertensive individual. And second, regarding physical activity, is the same as in diabetes. 45 minutes of brisk walking, at least 5 days a week, is more than sufficient. And the next thing is, again, medications. I assure you that hypertensive nephropathy is more dangerous than the mild kidney damage which is caused by the antihypertensive medications. So feel free and comfortable to take the antihypertensive medications as prescribed by your doctor. And moreover, hypertensive individuals you are not labeled to be hypertensive only during your first visit. Minimum of 3 visits taken at different times of the day at regular intervals, then only you are labeled to be a hypertensive. So once you are diagnosed to have hypertension, don't restrict your medications or don't avoid taking your medications, which will definitely have a future impact in your body. The third common disease of this age group is dyslipidemia, which is nothing but high cholesterol levels. So this high cholesterol levels may be mainly due to fried food, fatty food, and moreover, because of the oil consumption. We seem to be too economical that we reuse the oil every time after cooking. But just imagine that is the oil which is to be thrown out. It is thrown into your body and it gets deposited gradually over your blood vessels. So never reuse oil for cooking. All the fatty acids get converted into the non-essential ones, which is highly dangerous to our life. The second thing is regarding the oil consumption. Which is the safest oil to be used? The answer is no oil is safe to be used. The thing is, you have to go for a mixture of oils. For example, gingerly oil for dosa, and for frying, you can go for groundnut oil, and always use a mixture of oils. And the ideal oil consumption will be half liter of oil per adult per month. If it is kids, you can calculate it as quarter liter of oil per kid per month. For example, a family of 4 consisting of 2 adults and 2 kids would require only 1.5 liter of oil per month. Any oil consumption more than that is highly dangerous. So that is regarding dyslipidemia or cholesterol. And same with physical activity, 45 minutes of brisk walking, at least 5 days a week, and medications as and when advised by your doctor. And the next common disease is obesity, which is very common among all the age group. Now, childhood obesity is also a highly emerging problem. And obesity can be avoided by similarly with your diet, as well as regular physical activity can avoid obesity. There are even medications as well as surgical procedures for obesity, but that are not generally considered unless it is strictly indicated. And the most common problem encountered in this age group is depression. Depression affects 1 in 4 of the women of any age group. What is the cause of depression among this age group? You have newly entered your family life, or you have entered into your professional life. It really matters when managing your family as well as your professional life. You need a lot of strength and energy to equally balance both your family and career. So that stays a very important problem in most of the life of the women, and that ultimately results in depression, because your children are dependent on you. You have to take care of your kids. Or if you have newly entered into your married life, you have to get accustomed to the new relations in your married life. You have to totally accustom to a newer family. Similarly, in your career, if it is a new job or if you have entered into your professional life, you have to get accustomed to your colleagues. You have to be familiar with your bosses. You have to manage both your family and career, and that itself results in a lot of depression among women of this age group. Now, entering into the next period, that is late adulthood, which is 40 plus. So the moment you don't care about you and your health in your early adulthood, you start developing your future complications in the late adulthood. And what are the common problems is, similarly, as we have discussed, you are more prone to develop diabetes, hypertension, dyslipidemia, obesity during this age group also. But the more common problem which is encountered in women of 40 plus is menopause. Though menopause is a normal physiological change which occurs in the life of every woman, that leads to a lot of stress. What is considered to be a menopause? When you don't have periods for 1 full year, then only you are labeled to be attained menopause. And in case you get bleeding after 1 year, that is considered as postmenopausal bleeding, and which definitely requires medical care and attention. So coming to menopause, it can be due to two causes. Either it can be a physiological one, or it can be hysterectomy induced, that is post uterus removal due to multiple, it can be due to multiple reasons. So physiological menopause itself can lead to a lot of hormonal imbalance because your hormones slowly revert back to the normal before puberty. So it is a very gradual process. In spite of that, you have a lot of mood swings and hormonal imbalance in a physiological menopause. The pathological menopause, that is the hysterectomy induced menopause, is even more dangerous because all of your hormones suddenly come to zero from 100. So what you have is random erratic movement of your hormones here and there, which is going to put you under a lot of pressure. And this menopause itself can lead to two major problems. That is, it can be health related or psychological problems. Health related problems can be sudden acute bleeding, which you will never imagine. Some patients complain of painless bleeding on getting up from bed, totally their bed being soaked. So such type of bleeding can be expected during a menopausal age. And certain symptoms which can be similar to that of a heart attack, like sudden palpitations, that is feeling your own heartbeat, sudden excessive sweating, mood swings, irritation, which are similar to cardiac arrest, can also occur during this age group. And psychological problems, that is stress, which is mainly due to your hormones. Not only that, due to your family setup, can also occur during this age group. So when you are a menopausal woman, mostly your kids would have been self-dependent. They either take care of themselves or they would have got migrated for their higher studies. And for so long, you would have had a common discussion, a topic to be discussed with your spouse. Now, you both feel like having nothing to discuss among yourselves. And so long, your parents or your in-laws would have been helping you, or they would have been leading their own lives. But during this phase, they become your dependents, and you have an extra stress or burden of taking care of them too. So you feel like you are living for others and not for you, and there is no one to care for you. That is the main cause of depression during your menopausal stage. So support and help from your family members is the key point to overcome depression during your menopausal phase. If you require, there are certain pills also to overcome your menopausal stress and hormones, and that can be prescribed by your doctor based on your requirements. And once you attain menopause, you have certain problems which most of the post-menopausal women face. That is mainly because of the hormone estrogen, which comes to your baseline once you attain menopause. So the risk of developing heart attack becomes equal in a male as well as in a female. So until your menopause, female come to the safer side. That is, you have a comparatively lower chance of developing heart attack. But once you attain menopause, both male and female are at equal risk of developing heart attack. So how can you prevent that? By having adequate control of your blood sugar, BP. You have to have a regular checkup of this. Even though you don't have diabetes or hypertension, you have to have a regular checkup once you attain menopause, at least once in every 6 months. So that is usually advisable. And once you're diagnosed to have a diabetes, hypertension, or cholesterol, high cholesterol levels, it is better you take medications or follow lifestyle management as advised by your doctor. And the second thing which is commonly encountered among women in postmenopausal age group is osteoporosis or osteoarthritis. That is again due to a baseline level of estrogen, and that can be overcome by vitamin D supplements or exposing yourself to natural vitamin D, that is sunlight, during early morning or late evenings. And even vitamin D supplements are nowadays prescribed to maintain your vitamin D levels at ideal levels. So that is a common problem which is faced by the postmenopausal women. And one more problem which is encountered in this 40 plus age group is cancer. So there are three important malignancies or cancers which are affecting only female. The first one is ovarian cancer. Ovarian cancer is also a silent killer. All the symptoms of ovarian cancer mimic that of a menopause. So we misdiagnose it to be a menopausal symptom. So what we advise is when you are 40 plus, you always go for an ultrasound abdomen at least once in every year. Because when you have the symptoms typical of a cancer or a malignancy, by the time the tumor cells would have gone for rapid metastasis. So it is very difficult for the patient as well as for the doctor to pick out ovarian cancer at an early stage. So what we advise is once you're 40 plus, go for an ultrasound abdomen every year. The second malignancy is cervical cancer. And the good thing is that in cervical cancer is that it is a preventable cancer and there are vaccines available to prevent cervical cancer. So this vaccine should ideally be taken in the adolescent age group, that is after puberty and before your marriage. So it is available in the brand name of Cervarix, and it has to be given in 3 doses, 0, 1 and 6 months dosage in a women before marriage. So that can prevent cervical cancer because cervical cancer is caused by the human papilloma virus and there is a vaccine against this virus. The third cancer, which is very, very common, is breast cancer. And again, one good thing in breast cancer is it is a completely curable cancer when diagnosed at a early stage. So how can you diagnose breast cancer at an early stage? It is by a simple breast examination, which is commonly promoted now. So what you do is you examine your breast, that is you inspect your breast with your eyes, as well as you go for palpation, that is you feel for your breast. So how do you inspect? You just stand in front of the mirror, look for the shape of both of your breasts, look for the shape of the nipple, look for the position of the nipple, and look for any discharge in the nipple. If yes, immediately consult your doctor. The next thing is feel for your breast, that is go for palpation, and that has to be done under 2 steps, either in lying position and one in sitting position. So the ideal method for palpating your breast is by using your palm in circular motion. Start from inside of your breast, that is from the nipple, and gradually move out around in circular motion. Never feel for your breast with your fingers, because when you feel with your fingers, you feel for the fat globules which are present in the breast, and that creates unnecessary panic of having palpated a mass. So always feel for your breast with your palms. So once you feel for your breast in sitting position, lie down, because the lower quadrants of your breast can be palpated or better felt when in lying posture. And never ever forget to feel for your underarms, because even though you may miss a mass in huge breast, you can feel for a lymph node in your underarms. So always try to feel for your underarms to pick out if there is any lymph node enlargement. In case you find any abnormal mass or you feel for any abnormal swelling, immediately consult your doctor, because breast cancer is a completely curable cancer when diagnosed at an early stage. So these are regarding the cancers which are going to affect this age group. And finally, the topic is depression, which is going to affect any age group. And what is the reason of depression in this age group is you feel devastated. That is, you have completed your family, your children would have got settled or got married, and they have started leading their own lives. Your parents or your in-laws would be no more, and you and your spouse would have been left with a lot of problems, either mental issues or some physical health related issues, and that itself can lead to a lot of depression during this age group. And in this age group, you may have a lot of money and you may want to eat your favorite food, but you will be accompanied, you may be accompanied by acidity, diabetes, restricting your craving for food. You will have a lot of desire to travel around, but osteoarthritis will also be accompanying you and restricting you from moving around. So this is a phase in which you have everything, you feel like you have everything, but you feel like you don't have anything. And that is the age, even including your persons, your relationship, everything, you feel everyone is around, but you don't have someone to guide you, someone on whom you can lean on. So that is the common cause of depression in this age group. And how this depression can be overcome? By having the me time. Women often refuse to have the me time. Even though you have chances, we refuse to take the me time. We make ourselves that I'm committed to my family. I have to work for my family. I have to take care of my kids. I have to take care of my husband, and so on. And we gradually forget to spend our me time. These are the lame excuses which we ourselves give to satisfy us. And finally, there is nothing left but depression. Very boldly, I ask you in this forum that how many of you cook your favorite food every day, spend your own time to take the food and enjoy your favorite TV channel? The first thing which we say is, I prepared idli today because my husband liked it. I prepared puri today because my child likes it. But did you prepare the food which you like? The answer is no, because we don't have the time and energy to spend for us or preparing another meal which we would like or prefer. Most of the time we say, my daughter likes YouTube kids, so I wanted to share it for my daughter. Or my daughter likes to see cartoon, so I wanted to show it for my daughter. My daughter wants to enjoy. The moment your husband comes in, what do? My husband likes to hear news, so I give the TV remote to him. What about you? Watching serial is not at all a matter. You can watch, because if it is going to give you happiness, it is definitely what you can do. We never ever do that. We sacrifice TV remotes and dishes for our kids. We sacrifice TV remote and dishes for our husband, but never take our own time. And that is the reason for depression among female. So always have the me time. The me time may vary depending upon every individual. For example, my me time may be sitting in a garden. Your me time may be having a fresh cup of coffee. And how many of you have a cup of warm coffee, that is hot or warm, depending upon your taste? Enjoy your cup of coffee early morning. I think hardly 5 to 10%. Because for taking a cup of coffee, you need to get up at least 5 minutes earlier per day. And that is what we refuse, and we avoid taking it for ourselves. So taking a favorite thing, not only a cup of coffee or anything, listening to your music, watching your favorite TV show, reading your favorite book, anything and everything which gives you happiness, which is in the right path and which gives you happiness, you take time and make time for doing that. Because ultimately, this world, we all know, it is a temporary life. We all run behind money, power, profession, possession, everything. But ultimately, what we really want is good health and happiness. Happiness is what we all are craving for, and which can never be bought. It has to come on our own. So that has to be created, and that cannot be made by someone else. Just remember the simple concept. Iron becomes rusted only on its own. Nothing else can make iron to rust. So your happiness and your health definitely lies in your hand. It is you who have to decide when to be happy, how to be happy, and make others happy. Happiness always doubles, triples, and multiplies on sharing. So share your happiness with others. Be happy, let others happy. After all, in this temporary world, let us be happy and make others happy too. They thank each and every one of you for giving me this opportunity and spending your valuable time for listening to this session. Thank you. Thank you so much, one and all.
So thank you so much, Dr. Archana. Very, very informative session with very live examples. Most of the examples were relatable and very simple tips which each one of us can follow for our health. Now the session is open for questions. The participants, if you have any queries, you can shoot your questions to the speaker.
Good evening, ma'am.
Yeah, good evening.
This is Prema from Bangalore.
Yes,
Firstly, I would like to thank you for the very good explanation of what you have given and the phases, the problems what we faced in this age.
Thank you, ma'am.
Just I need a small clarification, ma'am, because you told our test for the breast cancer for the self-test. Can you repeat it again, madam? Because the one...
I'm not able to hear you. I could hear multiple voices.
Can you hear me, ma'am?
Yes, ma'am. Now I'm clear.
Ma'am, can you repeat the test, what you said for the breast cancer for the self-test, madam? Because you said one word there that because with the palm and all when you are testing, but somewhere you used one word, it creates unnecessary panic. That I want to make it clear.
Yeah, sure, ma'am. Actually, breast is made up of fat globules, as all of us may be knowing. So when you feel with the fingers, that is with the tip of the fingers, what we usually do is we feel for an object with the tip of the fingers. So when you feel with the tip of the fingers, what you feel is the fat globules which are actually present over your breast. So some fat globules may be joining together to form a mass, and that may confuse you to be either cancer or some abnormal swelling. So what we advise is feel with your palm. So feel like this in circular motion with your palm so that the fat globules will be compressed by your palm. So you will not have unnecessary panic of thinking the fat as some abnormal mass. So only a hard abnormal mass will be felt when you feel with your palm. When you feel with your fingers, you may mistake the fat globules for a mass. That is why we advise you to feel with your palm.
Thank you so much, ma'am. Thank you so much for the clarification.
Okay, ma'am. Thank you.
There's one more question from the chat box, Dr. Archana. Is exercise like yoga, asana, Surya Namaskar advisable during periods?
Yes, surely. But yoga, what they usually say is in the first 3 days of the menstrual cycle, it is better to avoid yoga because in the certain positions can cause compression over the uterus and that can lead to excessive bleeding. So for the first 3 days, it is better to avoid yoga, which is going to put strain over the body organs. Otherwise, mild, simple yoga and exercises are always advised.
Good evening, ma'am. I'm Mrs. Pariguna. I have a doubt. Why sometimes the pregnant ladies are asked to take insulin rather than giving tablets directly?
Yes, ma'am. Okay. So the main thing which we know is during pregnancy, most of the drugs are contraindicated. They are not advised to be taken during pregnancy because it crosses your placental barrier and it is going to affect your fetus. So the drug, the only injectable, that is the only medicine which is safe in diabetic mothers is insulin, because even though it crosses the placental barrier, it is not going to have an impact over your baby. And of late, nowadays, they are even advising one more drug, that is metformin. It is considered to be safe during pregnancy of late, but still insulin is the drug of choice because it does not have any adverse effects on your baby.
Okay, thank you.
Okay.
Madam, I am Shankari from Mayiladurai.
Yes, ma'am.
Madam, you explained the menopause problem and all.
Yes.
I want to know what type of diagnosis we need during the menopause, ma'am.
Diagnosis in the sense, I can't get you, ma'am.
What type of test we need, we are going to do for menopause problem?
Okay. So main thing is you don't go for hormone test. That is the first thing which I advise. Because definitely your hormones will be erratic during the menopause. So unnecessarily going for a hormone test will definitely put you on stress. So the main thing which we advise is go for an ultrasound abdomen. Because during menopause, you may suddenly develop acute excessive bleeding. That can be due to fibroid uterus, or it can be due to ovarian malignancy, or it can be due to some other causes also. So particularly focusing on menopause, the first thing which you have to do is take an ultrasound abdomen. And apart from that, you can have an ECG, which is mainly, as I explained, because you have the risk of developing heart attack. The risk is more in the postmenopausal women. So you can have an ECG and blood investigations mainly, which includes cholesterol levels, blood sugar levels, and have a regular BP checkup. That is more than enough. Never go for hormone assay.
Okay, thank you, ma'am. Thank you.
Okay.
Good evening, ma'am. This is Ishwari from Chennai, ma'am. you had talked about the cervical cancer for young ladies also.
Yes.
So is it a compulsory vaccination nowadays?
Nowadays we promote it, ma'am, because earlier it was diagnosed that people with multiple sex partners alone are more prone to develop this cervical cancer.
Okay.
Because it is caused by a virus, human papilloma virus, and that virus is transmitted mainly because of multiple sexual partners. But of late, it is even diagnosed to be very common in normal individuals also. So it is better and safer to go for the cancer and that cancer vaccine, and that has to be taken ideally before the first intercourse, at least 1 to 2 months before the first intercourse.
Okay, I have my sister's daughter who's of she's just very young. She's just in a +2 now. So is it advisable for her? Like,
yes, definitely it is advisable for her. And there is one more vaccine, as you just came up with this question. I'm putting on one more vaccine, that is rubella vaccine, which has to be taken during this age group.
Okay, rubella. Okay,
rubella,
okay.
yes, because rubella is not going to affect the mother. That is, it is not going to affect the person who takes the vaccine. But when you take the rubella vaccine, it is going to protect the offsprings. Okay. Because rubella can be a cause of infertility also. And that rubella virus infection during pregnancy can result in congenital anomalies in the baby. So it is safer to take rubella vaccine. That is German measles vaccine. And there should be at least a minimum of 3 months gap between both the vaccine shots. That is, rubella is a single dose vaccine, and Cervarix, that is cervical cancer vaccine, is a triple dose vaccine. So between two vaccines, you have to have a minimum gap of 3 months. And that rubella vaccine should be avoided in people who are planning pregnancy. That is, if your marriage is within 1 month, it's better to avoid rubella vaccine.
Okay, okay, okay. Yeah. Thank you so much, ma'am.
Okay.
Good evening, ma'am.
Good evening.
Ma'am, does doing Surya Namaskar cures irregular periods and helps in natural conception?
And I'm not able to clearly hear you.
Ma'am, does doing Surya Namaskar helps to cure the irregular periods and helps to conceive naturally?
Ma'am, I'm not clear with your question.
Ma'am, I have gone through a magazine that's it says that doing Surya Namaskar cures the irregular periods and helps to conceive naturally. Is it true, ma'am?
Yes, yes, ma'am, because that is going to regularize. First, the main thing is it will regularize your mood. And one more thing is it, there are certain pressure points, mainly focusing acupuncture, not going into it. There are certain pressure points which have to be activated for certain things in our body. So that is purely not going to correct your infertility issues, but that can help in correcting. For example, if there is a tubal block that is causing infertility, that cannot be corrected by a Surya Namaskar. But natural conception can be facilitated by doing those physical exercises.
Thank you, ma'am.
Okay.
Ma'am, this is Ishwari again from Chennai. So, ma'am, of late I'm having my, I searched the net and I found that the sciatic pain,
yes,
this is occurring very often, and I consulted an ortho doctor. He said like going for walking will be the best exercise to come out of it. But as you were saying, like many reasons, like people like us, we really don't give much time to ourselves. So is there any other some exercises that I could do myself and come out of this pain?
Actually, to be very frank, sciatica is not a curable disease. You have to understand that, because you can be free from symptoms of sciatica. That is, what is the main pathology behind sciatica is, it is actually the spinal cord which has gone for some little degeneration, which is quite normal. It can be due to heavy work or due to our insufficient calcium in our diet. Multiple reasons are that. Once a bone goes for degeneration, it can never be repaired. And what is the principle behind this is, the bone which has gone for degeneration is going to compress the nerves, because spinal cord is the origin of nerves, and that is going to compress the nerves underneath, and that is going to cause sciatica. Okay, so sciatica per se is not a disease which can be cured completely. You can be free from the pain of sciatica, that's all. So what you do is, all the things, for example, I can see, you have some injury over your hand. What you do, you allow it to heal. That is, you don't, you see that further you don't add more injuries to the same location. The same with sciatica, that is already it has gone for degeneration. And the more you put pressure, the more you squeeze that organ, the more you feel pain. So what we use, simple rest, that is lying on a very flat surface itself can relieve that pain. You cannot, again, be clear, you cannot cure the disease, but you can free from the pain by sleeping in a erect position. That is, your position of sleep should be comfortable and it should not cause pressure over the tip of your spinal cord. So that is the ideal thing. Second thing, avoid two-wheeler travels for long distances. So when you have a two-wheeler drive in a road which is not good, it can cause pressure over the tip of your spinal cord that can result in aggravating of the sciatica pain. Third thing, whenever you prefer a long travel, better go in sleeping posture so that your compression on your spinal cord, whenever you walk, your pressure falls on your ankle. Whenever you stand, pressure falls on your lower back as well as on your knee joint. Similarly, when you rest for long hours, your pressure is uniformly distributed to the body. So instead of going for exercises or anything, change your posture. For example, if you're a working woman, if you're going to sit for long hours, take 2 to 3 minutes break in moving around and come back to your normal position. You need not go for specific exercises to overcome this, but by simple day-to-day changes in your lifestyle, you can definitely be free from the pain of sciatica.
Yeah, thank you so much, ma'am.
Okay. Ma'am, good evening.
Good evening.
I'm Yamuna from Mailadurai.
Yes.
Ma'am, how do we know I am in pre-menopause or in menopause? Because I am in 44.
Okay.
I have some physical problems in my health from past 6 months.
Okay.
Is there any symptoms, common symptoms for pre-menopause or menopause? How do we face it, ma'am?
Ma'am, actually, menopause and menopause is that is complete cessation of periods for 1 year. That is menopause. The changes which you face before that is premenopause. That is the difference. Okay. So the main question will be whether it is premenopausal or not. That is whether you are going towards menopause or not, whether it is due to some other reasons. That is the main thing to be discussed. Once you don't get periods for 1 year, you have already attained menopause. That is over. So the premenopause, that is, you will have mental disorders, mood swings, everything which I have told you. How to overcome is, first, as I've already told you, main psychological problems you will get because of hormones, because you will have erratic hormones. So psychological stress you will get, and that is that can be overcome mainly by support from your family. Your family, you will have suddenly, it will be a very common thing, you will get moved out immediately. So that has to be understood and supported by your family members. They should understand that you are going through a phase and they should be supportive to you. And secondly, you have to engage yourselves in reading books or listening to music, because these are all hormonal imbalances. And you cannot alter, that is, you cannot give a supplement to maintain the hormone, because that is going to delay your menopause. So don't go for hormonal supplements during your premenopausal stage. Third thing, your bodily changes which you're going to get during menopause, there is a particular, so what you can go for some multivitamins, which I don't want to mention the name of the tablet in this forum because it has to be advised by your doctor. So you can go for some multivitamins which can regulate your moods. There are certain multivitamins and that will regulate your mood swings. It will not have an alteration of your hormonal levels. So that can regulate your mood swings. And main thing, you avoid excessive sweet and salt consumption during menopause, because menopause itself, it can have some fluid retention in your body. That will facilitate fluid retention in your body. So the more you consume salt, the more you have fluid retention, and the more you will feel this. You will feel this menopausal symptoms. So avoid sweet and salt in your diet. Go for minimal walking, and for correction of the mood swings, engage yourselves in things which can divert your moods, and get the help of your family members. If you're not able to withstand any of these, you consult your doctor. There are certain medications to overcome this perimenopausal symptoms.
Thank you, ma'am. Thank you very much.
So there's a question from the chat. Some home remedies for irregular periods.
First thing, irregular periods need to be evaluated. That is, you have to find out whether it is physiological or pathological. Ideally, getting periods from 21 to 35 days is normal. That is, women who is menstruating once in every 21 days may get 2 cycles in a month. That is perfectly normal. or it can be delayed up to 35 days. That is getting periods once in every 1.5 months. So 21 to 35 days is perfectly normal. And that cannot be labeled as irregular periods. One. Second thing, irregular periods can be either physiological or it can be pathological. Physiological in the sense, your body will be accustomed to get periods and to ovulate once in every 35 days or more. And that is totally physiological. So how can you find out whether it is physiological or pathological is? First, you go for a hemoglobin test. Either low hemoglobin can result in irregular periods, or irregular periods itself can result in low hemoglobin. That is a mutual problem. It is like a cycle. Irregular periods, low HB, irregular periods. So that will be a cycle. So first thing which you have to find out is your hemoglobin level. Second thing is hormonal level, particularly prolactin levels. That is, in a long non-lactating mother, if the prolactin levels are high, that can also result in irregular periods. Third reason can be thyroid problems, either hypo, that is low thyroid hormone, or hyper, high thyroid hormone. Both can result in irregular periods. And moreover, some pathology in the uterus that can be overcome by doing a simple ultrasound abdomen. Any pathology in the uterus can also result in irregular periods. Definitely, some pathological causes of irregular period will fit into any of these: hemoglobin, hormone, or defective uterine problems. If not, and you get periods between 21 to 35 days, that is twice in a month or once in every 1.5 months, that is perfectly normal.
Thank you, doctor. There's one more question. How to diagnose menopause in thyroid patients?
Okay.
Thyroid patients already have periods.
Yes. Thyroid, right. Okay. So when thyroid is corrected, that is always for thyroid, hypothyroid individuals, once you're already hypothyroid, your TSH level matters. Never consider about the T3, T4 levels. TSH level matters. If your TSH level is ideally under control, then you need not worry about hypothyroid levels. Even though you are a hypothyroid taking L-troxin for the same, if your TSH level is under control, it need not be worried about hypothyroid. It can be a menopausal symptom.
Thank you, doctor. There's one more last question. Whether anemic individual affects the menstrual cycle?
Definitely. But there are certain conditions in which even patients who are anemic, they menstruate regularly. That depends upon their uterine capacity. That is because each cycle, a particular ovary undergoes that rupture of the endometrium, and that is going to shed. So even some anemic individuals may have normal periods, and so periods itself. So main thing why anemia affects periods is during periods there may be heavy blood flow. So that can result in anemia. The one more thing is when you are anemic, what happens is your blood becomes diluted. That is, the RBCs in your blood are reduced, the plasma volume of your blood increases. So you may be getting excessive blood flow during the cycle, but that blood may not be purely due to anemia itself. So to be very clear, when you bleed more, you shed more, so you become anemic. Similarly, when you are anemic, the thickness, that is the viscosity of blood reduces, blood becomes thin because of high plasma concentration, so you bleed more. So that is like a cycle.
Thank you,
Good
doctor.
evening, madam. Madam, I'm Valarmati. Can you able to hear me, ma'am?
Yes, ma'am, I can.
Ma'am, I and my mom have one problem, ma'am. That is a continuous burping, ma'am. A lot of body pain, ma'am. Burping.
Okay, burping, right.
Okay. Because of ma'am, a lot of body pain and head pain is there, ma'am. When we press some parts in head, we feel that kolagalan irukka mari oru feel agum. We press pannona a lot of burping continuously. It is coming for 15 minutes like that, ma'am. My mom is having that problem. Nowadays, I also having that. My mom is having for 1.5 years, ma'am.
Okay.
Initially, it was less, ma'am. Nowadays, she is having a lot of burping, ma'am.
Okay.
It will come for half an hour, and then for sometimes it will not come, ma'am. After that, it will continuously, it will come, and it irritates throat also because of continuous burping. What's the reason, madam?
During this continuous burping, is she getting cough?
No, ma'am. Cough is not coming. Only burping alone.
Only burping. Okay. Is she taking any other medicines for diabetes, hypertension, like that?
No, ma'am. No medicines we are taking.
How about her diet? Does she take the diet at correct intervals?
She may delay, ma'am, in morning after completing all the jobs only, all her work. Then she'll have.
Around what time?
I also sometimes at 10:30, before 11, ma'am.
Okay. So does she take a tea or coffee whenever she gets up from bed?
Yes, ma'am.
Okay. So just a few points about this is just GERD, which you call it as gastroesophageal reflux disease. Okay. So regarding GERD is that is mainly acidity. What happens is you may be already knowing the food passes from your mouth to the esophagus and enters into your stomach. Your stomach produces hydrochloric acid for digestion of the food. So your stomach has a layer which is going to withstand the acidity of hydrochloric acid, but that acidity cannot be maintained by your esophagus. Esophagus does not have cells which can withstand the acidity. So the commonest complaint is the food flows back because your esophagus, the end of the esophagus has a sphincter, lower esophageal sphincter, which prevents reflux of food from the stomach to the esophagus. So when due to your dietary habits, delayed dietary habits, lot of hydrochloric acid begins to secrete in your stomach and it disturbs the lower esophageal sphincter. So what happens is the food goes for regurgitation, that is the food which has to actually flow from the esophagus to the stomach flows back from the stomach to the esophagus. So as I've already told you, esophagus does not have the cells to withstand the acidity of hydrochloric acid. So that can stimulate burping. And how can this be avoided is, the first thing which she has to avoid is taking tea, coffee or milk in empty stomach. As you may know, milk contains lactic acid. Already her stomach is filled with hydrochloric acid. When you put on lactic acid after an overnight fast, that is going to aggravate the symptom. So the best diet which I advise for her is, after waking up in the morning, tell her to take as much of water, up to 1 liter of water in empty stomach. Leave at least half an hour to 1 hour gap. Take freshly prepared curd. That is the curd which is prepared the previous night. It should not be sour. It should not be kept in a refrigerator. And that curd has to be consumed after taking water in empty stomach. And even before that, she can go for gargling with gingerly oil. Pure gingerly oil. She has to keep it in the mouth, gargle for at least 15 minutes and spit it out. So in case of any acidity in the passage of the food, that can be healed by this gingerly oil. Then tell her to take freshly prepared curd after gargling with gingerly oil. So the curd, it is rich in lactobacillus, and lactobacillus is needed for healing of the gastric mucosa. So she has to go for freshly prepared curd, which is not sour and not refrigerated. So once this is done, the hydrochloric acid, which has been secreted overnight, is neutralized by the curd you take, by the gingerly oil, as well as by the water. And after that, if she goes for a diet by around breakfast by around 9 to 9:30, she can definitely feel better. And tell her to take food which is rich in basic substances, that is alkaline substances. For example, avoid spicy food, spicy chutneys or something, at least for a period of 1 to 3 months until she develops complete healing. And as I have advised a diabetic diet, tell her to take meal once in every 1.5 to 2 hours. Don't take meal in bulk. Split up the meals, take meal for every 1.5 to 2 hours. Then lunch at the correct time without any spicy food. And once again, snack, then dinner. And dinner has to be completed before 8 or maximum before 9. And after dinner, minimum of 2 hours, she has to sit straight because already her lower esophageal sphincter would have been damaged. So it can easily cause reflux when she lies down immediately after having food. So tell her to have at least 2 hours of gap before going to bed. So by following these, initially it will take little time for her to already overcome the healing process. By 3 months, all the symptoms should have subsided. In case not, it is advised to go for an endoscopy.
Okay, madam. Thank you, ma'am. Ma'am, one doubt, ma'am. After gargling with the gingerly oil, she need to take water, then curd, ma'am. Okay. Okay, madam. Thank you, ma'am. Thank you.
Okay.
Doctor, one last question. How to overcome period pain?
period pain is initially perfectly normal to get pain because the uterus goes for some contraction to push out the blood as along with the endometrium. So that is first thing is normal. So to overcome the pain, as I've already advised, during periods, we have fluid retention in our body, avoid consumption of excessive sweet and salt during periods. Then second thing, you can have a pillow underneath your lower abdomen to support so that the cramps or the compression will be overcome, or it can be relaxed by keeping a pillow. And next thing, can have warm water massage, that is either hot water baths or some warm water massage over the lower back as well as over the lower abdomen. By doing that, the pain can be relieved to a certain extent, but getting pain during cramping is perfectly normal.
Okay, doctor, thank you so much. It was really very, very informative session. On behalf of all the participants and the entire Nirmala family, I extend a very hearty thanks and appreciations for your very informative session and your patience in answering to all the queries of the participants, also basic questions, and there were very difficult questions. You were patient enough and kind enough to answer all the questions. And thank you very much for sparing your valuable time for all the participants and from the entire, on behalf of all the Nirmala family, I extend a very hearty thanks to you, Dr. Archana. Thank you so much.
Thank you. Thank you so much for this opportunity. Thank you.
Thank you. Thank you so much. Yeah.
Thank you, ma'am.
Thank you.
Yeah.